cool. All right, we'll just dive in.
Great.
Hey everyone, and welcome back to Epic Gun Time. I have my brother-in-law Phil here today, and he's going to help me put together my Battle Belt med kit. So I got this Battle Belt from T-Rex Arms, and it came with, of course, a tourniquet, which is really cool of them to include. But it's empty, it's gutless, and so my brother-in-law Phil, he's very much experienced in this area. So I thought I'd bring him to help me build this kit out. So, and then talk about some other medical stuff. So anyways.
Great. So guys, my name's Phil, obviously. I started out in the Marine Corps and then switched over to the Army side of the house. I've been doing medic stuff for about 8 years. So I've got a lot of experience playing with all these different stuff and in a field environment. I'm not a PA, I'm not a doctor, but I do know my way around first aid. One thing I want to, before we get into all this stuff, one thing I really want to emphasize is the difference between a doctor and the guy off the street is not all the cool stuff he gets to play with. That helps. The difference is the training. He's gone to school for 8 years. He's done all this stuff.
Right.
So before you go out and spend a large amount of money, because it's very easy to spend a large amount of money on very good medical gear, maybe get some of the basics. And get a couple extra that you can train with, and then look up a reputable face-to-face training environment in your local area, and make sure that those guys. I like being military. I like to base everything off of what we call TC3, which is how to operate medically in a tactical environment, if that makes sense. And there's a lot of really good courses throughout the country that follow that, and we'll walk you through everything. EMT courses at your local college, also a great idea. But at the end of the day, you can have all this cool equipment, but if you don't know how to use it, it's not going to help you.
That's right. Oh man. So the only thing I've done is I've done a Stop the Bleed course.
Great.
So that's
a wonderful place to start.
It seemed like a good place to start, and it basically I think you learn how to make people miserable if they have a gunshot wound. You're packing it full of stuff or something.
Yep. Like that. It's not fun. So with the Stop the Bleed courses, that is a lot of that comes from OIF, OEF. As a country, we've been at war for almost 20 years now, and we've learned a lot about how to stop the bleeds. I think they did research at one point, and these stats may not be 100% correct, but something like 80% of the preventable deaths were from extremity bleeds.
Wow.
So that Stop the Bleed course is really a great place to start.
Pretty good foundational. So next, so if I've done the Stop the Bleed course, what's kind of like next level 2 if I don't want to do 4 months of EMT training or something like that?
Right.
What's
even a basic first aid course. Once again, there's a lot of. You can look them up online. There's a lot of ones that are OSHA approved for a lot of people's different job sites and different specialties. Any medical training is better than none.
Right.
A basic first aid course would be another good step to go to, or they make specific ones for backwoods, wildlands, search and rescue. That would be another great avenue, and they're usually like a 2-day, 3-day course that gets you the basics and gets you up and running.
Nice.
And that's a valid point. Nobody wants to go to school for 4 months to learn how to use their first aid kit.
Not really. So today what I got here is I got, of course, this kit that we want to build out. I got my old first aid kit from, I think I built this thing out right after I did my Stop the Bleed course. So we'll even see if what's in here is good.
Yep.
And then I got like a bigger medical kit that I think my wife got me for Christmas or something like that.
Kind of more like your truck kit?
Yeah, kind of more like the truck kit. And so you can kind of go through that and tell me what you think. And we'll just kind of go from there. And then we'll show people, like, what is it you carry around? Like this.
Right.
So that's cool.
I did not bring my truck kit, but I did bring what I use for more of a tactical field environment. I'm not carrying around my 90-pound freaking aid bag. Right,
exactly. So let's open this thing up and see if anything in here is even usable in my new kit. Like,
I think I've seen the inside of this one on a previous video, so I'm pretty sure that these are actually really good things.
Okay, so we got, what is this thing?
This is a SWAT
Got the SWAT T.
So this is basically a compression bandage. I don't have a lot of experience with this one specifically. I know it's like a polymer high elastic kind of deal, and it's really good for putting pressure directly on wounds. Wonderful thing, especially if you pair it with some gauze and you want to make a trauma bandage type situation out of it. because I don't have any experience with this, I don't know how
Sure.
effective it is as a tourniquet. I stick to the Army guidelines because that's what I do.
Right.
So, and that is not in it, unfortunately.
I feel like when we were doing the Stop the Bleed course, I think that the nurse teaching this course actually she had us play around with this for a little bit. So I think we had one we were playing around with. It was pretty cool. I actually need to go through and like relearn how to use this thing.
And that goes back to a little bit of what I was talking about earlier, is if you're going to get something, get 2 or maybe even 3 of them so you can tear one open.
That's fair.
Play around with it, figure out exactly, grab your buddy and practice putting on that tourniquet until it's muscle memory.
Right.
Practice doing those things. This is actually a piece of equipment called the emergency trauma bandage. I am really, really familiar with this guy.
Okay.
So this is going to be, this is a pressure dressing.
Here's the
Oh, there you go. Emergency trauma bandage.
Hey! It's kind of hard. It comes all crinkled up. Why is it just like vacuum
So this is
sealed?
vacuum sealed, and it's built so that I can throw 4 or 5 of these in a very small area and still have room for other things.
Okay, nice.
Extremely, extremely effective. This does not have what like a hemostatic agent. This is purely pressure based.
Okay.
So if I have like, let me see your forearm real quick. So if I have like a large, you can see all these veins and everything on your arm.
Look at those veins.
If you have like a laceration or something that's not necessarily arterial, that you want to put a good pressure dressing on it, this is awesome.
Okay.
And it'll cover up, protect that wound, put lots of you could put some serious pressure on that wound with these.
Okay.
Really, really good.
Great.
If it's, and like I said, that's more for your non-arterial type bleeds.
Okay. Non-arterial.
If it's spurting, yeah, you're going to want to move more towards, let's say, a tourniquet.
Call 911.
Call 911. Yeah. Very quickly.
Okay. And then we got this quick clot advanced clotting gauze.
Yeah. So that is, some of you guys, if you were in the military back in the 90s, might remember Quick Clot. It was a powder that we would pour onto a heavy bleed wound. This is also made by Quick Clot. So they got away from that because the way that stuff worked was it actually heated up and got really hot.
This stuff?
No, the old Quick Clot.
The old Quick Clot.
And they've gotten away from that. So this is not that, because it was getting up, and if it was windy out, it would get into people's eyes and mess them up.
Oh, yeah.
So this is Impregnated Gauze.
Okay.
It's very similar to this. This is more of a pad, whereas this is Z-folded, like it's kind of like a big ribbon of gauze. Okay.
Okay.
These two are both very good. This is more for an exterior application. Like if you look at the back here, it'll show you place it on the area that's bleeding, hold pressure for 3 minutes, and then put a compression bandage over the top of it, like a normal ACE wrap.
Okay,
right?
all right.
Whereas this stuff is for bleeds, heavy bleeds that are compressible, which we can get into that if you want. Where I can't get a tourniquet to. So high up into like your groin, into your armpits, maybe on your neck, where you're gonna have arterial bleeding, but I can't get a tourniquet high enough up to really tie that sucker down.
Right, right.
So I'm literally gonna take my gloved finger and I'm gonna pack this inside the body.
Oh man.
Yeah, it's really not fun for the patient.
Yeah.
It does have a strip through the middle of the gauze that does show up on X-ray, which is really nice later when you get them back to that hospital or that surgical suite, so they can pull all of that out and make sure they get it all out.
Okay.
So it's very helpful. None of this stuff is cheap, but it's extremely effective and extremely helpful.
Okay. That's great.
Yeah.
Good to know. Good to know.
Absolutely. Also, if we're doing Stop the Bleed,
Great.
we can go right to this guy right here.
Okay. I don't even know if that's a good one.
I don't think this is a good one.
Okay.
So this looks like a knockoff.
Yeah. It might be.
It's very hard to tell, even for a guy like me that's played around with these a lot, whether this is a Cat5, which is the previous generation of the combat application tourniquet. It's really simple. You just run the loop through over the affected extremity. You tighten it down, you put your Velcro in place, and you turn.
A little bit more.
Oh, yeah.
There we go. Sorry about
there
that.
we go. Sorry about
I
that.
can stretch this camera a little bit more. Okay, there we go.
There we go. So you're just going to tighten this down. You're going to place the Velcro over my teeny tiny forearms, or bicep rather. You're going to tighten your windlass down and then hook it in. Right time on the label.
Nice.
This would be a really good one to practice with.
Yep.
It's the same exact.
We'll leave that one undone, and that'll be my practice one. Well, actually, I won't leave it undone. You got to practice it taking this thing apart. But.
These guys are legit. This
Okay.
is the, no kidding, combat application tourniquet, if I can talk.
Okay.
This is the Gen 7. So these ones are really nifty. It has a reinforced, this long bar piece here is called the windlass. I think I have one that's actually open right here.
Oh, nice. Look at that.
Ta-da! So, you can tell this one's been trained and written on, and this is one of my training pieces. A lot of the stuff that you're going to see me pull out of my kit has been played with and trained with.
That's great.
But it's the same principle. You're going to run it through the loop, and you're going to use this device. This is called the windlass. It's obviously much thicker and heavier than this guy.
Yeah.
So it's not going to be as prone to break because you're going to put some serious torque on these guys, especially if it's a leg wound.
Yeah.
You're going to hook it back into your retention device here and put this Velcro strap over the top of it, right the time that you applied it to. Throughout OIF, OEF, we have learned through the military that tourniquets are not, there used to be a really bad association with tourniquets, that if you left them on for more than a certain amount of time, that they're just going to lose that limb from wherever the tourniquet was down.
Right.
It's shown not to be the case.
Okay.
6 to 8 hours, and you're still going to be just fine.
Okay.
If it takes you 6 hours to get to the hospital, you are in some deep kimchi to begin with.
Right.
Most of you guys are not going to be doing like austere environment stuff like we do in the military.
Don't leave town.
Don't leave town. Yeah. Or if you do, bring a cell phone.
Right. So would you this is one you've obviously trained with.
Absolutely.
Would you put this in a pack and use it, like plan to use
If
it?
this is what I had.
Okay.
There are a couple of different theories. The official story is once it's opened and once it's been used, you don't use it on an actual live patient.
Okay.
Because the argument is that this windlass is plastic, it will get worn out.
Yeah.
There is actually, this is literally 3 layers of material in here, and there's a piece sewn into the end, and that's, you can actually see it, comes out and runs through your windlass, and that will get stretched out, and you won't be able to put as much tension on it.
Got it.
I can tell you, having used 7 or 8 of these, or one of these 7 or 8 times, that they still put plenty of traction.
Okay.
If that's what you have, I recommend keeping a couple of new ones. Maybe not necessarily in the packaging, because that's just going to slow you down when it really comes to down to things.
Right.
But have them marked some way that you know that those are your new ones and that you haven't played with them. That's why I have the time written on that one. So if I do end up grabbing it, I know which one's which.
Okay. Great.
Yep. Let's go with some gauze. Gauze is another great thing. This is made by North American Rescue. This is the same stuff I am issued in the military. I love it.
Great.
So you guys have probably all seen those big bulky rolls at Kerlex. They take up a lot of room. They're big puffy. This is the same amount of gauze in the same width, and about 1/8 of the space.
Okay, it's just like super compressed.
Super compressed and vacuum sealed. As soon as you open it, it's going to puff up a little bit. You grab an end, and it's Z-folded, just like the combat gauze.
Okay. It's like one of those purple mattresses.
Yeah, exactly. So it just, great stuff to have. That's something that you can apply to. You can use it to back up your combat gauze. You can use it to secure a wound and cover it up and kind of protect it. Yes. You can use it to, if that's what you got, you can use it to stop a bleed or create your own compression dressing if you need to. Okay. If you don't have one of these handy dandy guys, you can pull out an ace wrap or your SWAT tee, throw some gauze on top of it, pack it down, wrap that sucker up real tight. It's going to pull good traction on top of that wound, or good tension on top of that wound, and help stop the bleeding that way.
Wow. Okay, awesome.
Yeah.
Cool. So, and what's this here? I got a bunch of this.
Yeah.
What do I do with it?
So, these are triangle bandages. And they are not necessarily stop the bleed, but they are just darn stinking handy to have.
Okay.
These are really good for, actually, I think I have an open one right here. Please hold. Maybe. Maybe not. So they also come in packages that look like this. These are the ones that the military uses.
Oh, wow, look at that.
So it just, all these is a large piece of triangular fabric.
Okay.
Okay. They don't have any fancy anything to them, but we've been using them since Vietnam at the very, very earliest or very latest. They're really good for doing things like binding wounds.
Okay.
If you want to put a little extra tension on it, protect it a little bit. They make really good slings. They can help with your splinting. They can use to be immobilize different limbs if you have an injured limb. They're just really handy to have. I always carry 1 or 2 of these. They also make a great impromptu face mask when you're driving through the dusty desert.
Oh, okay, that's good. That's good to know. So they got this package of them. These are individual though inside of
Absolutely.
This thing, so that's cool.
Yeah, so they all usually come with a couple of right there, a couple of the little safety
Diaper
pins to kind of help tie things in place.
Yeah.
One other big thing that I really like having, especially with a stop the bleed, is 3-inch medical tape or duct tape.
Okay.
Duct tape works fantastically well.
All right.
But throwing an extra layer of tape and just getting that little bit more security, this stuff's pretty tough, but it rips easily to get it off the roll.
Right.
Works wonders.
Okay.
Hey, I've got this emergency trauma bandage, and I've got this loose tail that's kind of velcroed on there. I'm going to throw a couple of rolls of wraps of tape over there to make sure that sucker doesn't move. Same with my tourniquets. Same with my triangular bandages. I'll tie a knot and then I'll wrap a little bit of tape around that because as I'm loading, keep in mind when I'm doing stuff, I'm offloading these guys out of medical vehicles, out of helicopters, and the more they move around, the more prone that things are to shift and move, and then you start bleeding again.
Right. Okay.
Yep. So tape is always a good thing. Also works really good for hot spots on your foot if you've been doing a lot of walking.
Oh, that's good to know.
Yeah.
That's really good to know. Okay, cool. Oh boy. So like one says I feel like some of these things I got like they're not going to fit. They're not going to fit in here. But what?
No, that'd be great. This actually this thing. So it's so thin you can actually fold it up.
Okay.
And roll it up.
Would you recommend that's a thing to put in a kit?
So this is like I said, guys. If you don't know how to use it, it's not going to do you any good.
Right.
This is what we call a chest seal. Halo chest seals is my personally preferred brand. And what that is for a thoracic wound, penetrating wound. So you have most people have heard of like a sucking chest wound. That is to cover that up. Okay. Or you get a bullet wound through the thoracic cavity, the chest. You're going to want to put one of these over there so that air cannot come from the outside into the chest cavity and collapse your lung. Okay. That's what that's for. It's not going to necessarily stop bleeding, but it'll keep them breathing, which is also a good thing.
Okay.
And I like these. It is a 2-pack in one package, and then the package is actually the right size that if you do need to use the package, you can run some tape around the edges and away you go.
That's awesome.
Yeah.
Okay. I see what you're saying.
Yep. So you can just, even if it's open and been used, I can tape down these sides over the wound, and it'll seal up pretty good. There's actually a cool video on one of the other YouTube channels, Funker530, of a cop. He didn't have a chest seal, so he ripped open his bag of potato chips, dumped it on the ground, taped it down, and the guy lived.
Oh my goodness!
Saved the guy's life.
Oh, good. That's awesome.
So those are really good things to have. I like them because they're so thin. If you guys can see my little kit here.
Oh, nice.
I've got 2 or 3 of those guys stuff.
Oh, that's awesome.
Yeah, they just fold right up. Not a big deal.
Okay.
Sam
cool.
Splints.
All right.
So we both know somebody that I used one of these on.
That's right.
These are your splinting material. This is for your rolled ankles, your broken arms. They're highly manipulable, so you can fold them in all sorts of fun designs. I actually have one here that I've used for training.
Oh, awesome.
You can cut them down to size, as you can see on this rough edge. You can cut them down to size with a pair of trauma shears.
So like a aluminum in there?
Yeah, so it's like we call it an O-temper aluminum. So it's very flexible, but it's not. Also, the more you can bend the crud out of these things over and over again, and it's not going to break or crack.
That's awesome.
You can also X-ray through those. So
no
you
kidding?
don't have to take the SAM splint off to get your X-rays when you're back at the hospital.
All right.
But you can do things like, obviously, it's very floppy this direction until I roll it up, and it becomes very, very stiff.
Okay.
So
that's really cool.
Fold these into different shapes. We like one of the common ones is like the sugar tong, which basically just goes, roll that down a little bit, and it's going to go around, and that's going to protect if you have a suspected arm fracture. You're going to kind of cup this thing so it doesn't move around.
Okay, all right. So it's going around your arm.
It's going to go around the back of the arm, kind of
There you go.
Looks like a giant sugar tong. You can use this on the foot as well. And then we're going to wrap that up with an ace wrap. We're going to pad the voids. Make sure we have patient comfort in mind as well with that. And that'll help protect that until you can get to a higher level of care.
That's way cool.
I love these things. The other thing you can do is you can actually take them out of your, where'd yours go? Your packaging here. These are folded flat. That's the way I usually carry them. You can actually get them in a roll as well if that's your preferred method.
Okay.
Then you don't end up with these creases, which is kind of nice sometimes.
Okay.
But those are extremely, extremely useful tools.
That's great to know. So this would obviously be in a bigger pack. I'm not going to fit this
that's
in my
going to be.
kit.
I'm not worried about sprains and strains at the tactical level. Okay, so that's going to be more in your truck kit. If you're hiking around, you roll your ankle. Maybe you want to if you're hiking way into the backcountry, you might want to consider taking a little bit. I kind of move and adjust my kit based on what I'm doing at the time.
Right.
So if I'm going 5 miles into the backcountry, I might want to consider throwing these into my pack in case I do roll my ankle, so I can walk my happy butt out of the woods.
Right. Exactly.
That kind of thing.
All right, so for this purpose, what do I want to put in here? I got obviously I want the Cat5.
Yep, you have the Cat5. That's a great place for that.
I took this one out of its packaging. What are your thoughts on that? I know that there's
as long as you know that you are not that it's attached to your gear, right? So it's not something you're just going to grab to play with.
Right.
Great.
Right.
Okay. Keep in mind these also do technically expire because all plastics get brittle as time wears on. So you might, every couple of years, take a look at your expiration dates, consider replacing them as well.
Right.
I actually like that is open and easily accessible.
Ready to roll.
That's really nice.
Okay. Okay,
That's
cool.
Great.
It was kind of cool. I don't know. Maybe this is handy.
That looks like it'd be perfect for an emergency trauma bandage.
Yeah. Okay. All right.
Maybe, so this is sectioned off. And this, I apologize, it's the first time I've seen this kit. It looks actually really nice. But I bet you we could squeeze one of these guys in there.
Okay.
The triangle bandage is something, I might throw one in my kit, but it's something more that's going to leave in my truck kit. Like my tactical on my belt kit is, I need to stop this bleed right now.
Right.
And then I will worry about the rest when I can hobble them to the truck, or I can run to my truck to grab my gear and come back.
That's fair. That makes sense.
I would put your combat gauze or your, so most of this stuff's going to be stop the bleed.
Right.
Maybe a Halo chest seal in here too.
It's like this guy here.
Yeah. I would put stop the bleed. This would be a wonderful place for that, or your combat gauze. Either one would be very good.
The combat gauze, this stuff here?
That is compressed gauze, also a good thing to have. Your combat gauze was the green stuff.
Oh, okay.
That guy.
Got
so
it.
if you have that, I would definitely put that in on my belt. At least 1 or 2 rolls of it.
All right. So we'll throw that in there.
Slide that guy in there.
Just
like so. Maybe open up this main bag. These are 2 separate packages.
Oh, it's 2 separate ones. Okay.
Maybe put those on there. Honestly, might consider a second tourniquet. It's not uncommon, especially with leg wounds through the thigh. That thigh muscle, that's a lot of muscle that you got to put a lot of pressure on.
Right.
So sometimes it does take 2 tourniquets to get the bleeding completely stopped. Or you didn't pay attention to the expiration date, or you're using a training tourniquet and you break your windlass. You don't want to be up a creek without a paddle. I really like that knife.
Thank you.
That's very nice.
All right.
So a little bit of compressed gauze for your...
A little bit of that.
Yep. And then I always throw a couple of, I call them boo-boo stickers.
Not to be confused with combat gauze.
Right, that is standard compressed gauze.
Compressed gauze.
Yep.
So I wonder if I throw this in this thing here.
That'd be a great spot. You could probably fit 2 of those in there.
Yeah, yeah.
On that side.
Okay.
And then...
But then you're saying like combat gauze I'd throw in there. Do I have any combat gauze? Well, maybe not.
Let's take a look. A couple of SWAT tees. Honestly, that wouldn't be a bad thing to throw in there.
Probably not a bad idea. Okay.
We got some Coban. We got some medical tape. Some normal gauze. Ooh, a couple of... What do we got here? Ooh, vented chest seals. Very nice.
Oh, yeah.
Yeah, so these are also made by North American Rescue. They make some excellent products. But you could, that is a 2-pack. You could fold that up and that sits right there really nice.
Okay, all right.
Yep. And then let's see. I thought I saw some combat guys. Aha!
Look at that.
Look at that.
Okay.
I'd slide that guy in there too. Yep.
All right.
This is a different brand of emergency trauma bandage. Trauma dressings, also made by North American Rescue. H&H also makes some really good ones.
Okay.
So you have options. These work very well. A couple extra tourniquets. Yeah, you might slide an extra tourniquet in there if it'll fit.
Let's see here. So if I do this,
Or-
what were you saying I should I do something like? Oh wait,
Yeah, those are the chest seals that we talked about earlier. These are non-vented. Those are vented. Currently, the guidelines in my career have gone back and forth a few times on whether you want it vented or non-vented.
Okay.
Currently, they recommend that it's vented.
Okay.
Yep.
So this is
I
ideal.
just looked it up last night to make sure I was on top of things.
Right. All right.
Yep. And that's like I said, there's 2 of them in there, so you have entrance and exit wounds. You need to cover those both as quickly as possible.
Okay. I wonder if I should just like go. No, that's not going to work.
Not going to work. You know what I do, honestly, is so I have my shooting pants that I go shooting with because I'm that guy.
Right.
And I have a Cat5 that I haven't used in my pocket.
Okay, just in your pocket.
Yep, just in your pocket. It's nice, quick, easy to access. Even when I'm rolling around doing dirty medic stuff, I have a small pocket on my trousers that down by the ankle that fits a tourniquet just perfectly.
Okay. Nice. So, I mean, here's. Hopefully, it opens up super easy, right?
Yeah. Sometimes it's a bugger to close, but those
I'm
are
sure
that, and that is a tight pouch. Some other places that make a really good pouch is North American Rescue makes one. That's actually that green pouch that I showed you guys a few minutes ago, and we'll go over that.
I'm sure, I'm sure the idea is like just quick grab and go.
It's
and
a grab
like
and go. It's
everything-
slimline, so if you're moving through doorways, if
grab
you're in a
this and-
vehicle.
Yeah.
Yep.
But I
is
could
the
just
idea
throw
before.
all these things in here. The downside is that this pouch as a whole does not just come off.
That is true.
So whereas like my old battle belt actually,
I like that.
this
just
was
drops
made
off.
to just pull off
rip
your
and go.
pouch. So there's some things to think about there.
Yeah, absolutely. And the great thing, looking at these two, let me see that guy real quick. If you really wanted to.
Just have two.
If you're expecting a real bad time.
That's right. That's right. Okay.
No, that's a great little rip and go. I like that. Another thing that you might try and slide in there, it looks like everything's pretty tight, is a set of trauma shears. So one of the things you're going to need to do if you do have a casualty is you need to be able to evaluate what that wound is. Is it just a scratch? Is it a bullet hole? Is it what do we got? So trauma shears will help you remove that individual's clothing. They'll cut through boots. They'll do some crazy things, and they're very inexpensive.
Let's see. Like these guys here.
Like those guys there.
These are titanium.
Ooh, fancy schmancy. These guys are just run-of-the-mill, trauma shears.
Right.
They're blended so that as you're cutting up someone's pant leg, you're not trying to dig into somebody's leg and cause more damage than you already got.
Okay.
And these things will cut through seatbelts. They'll cut through pennies. They'll cut through boots. They'll cut through whatever you need them to cut through.
That's awesome.
Yeah. So I carry a set of those, and some other stuff as well.
Okay, cool. So, I got to figure this out, obviously. I need to figure out how it's going to all fit in here. Maybe ditch
and play
this,
with it, rearrange
play
that.
around. Yeah.
Do what you got to do on that guy.
But
it looks like you could probably get a couple of panels that would just Velcro right in there, and then as you open it all the way, everything's laid out nice and.
That would be nice, right? Okay, but at least I know what I need to have in here now, so that's great.
And that's just kind of the basics. Really, you could get a lot, and I see a lot of guys do it. Tourniquet, a little bit of gauze, ace wrap, and let's say a chest seal for funsies.
Right. That makes sense.
That would be a very basic. Out on the range, we do have guns that are going boom. Accidents do happen.
Right.
I actually just met a guy that he was at a 3-gun match and had another competitor ND into his leg.
Oof.
Yeah, with a 6.5 Creedmoor.
Oof.
Too. Yeah.
Wow.
Yeah. So
this is kind of like basic. This could very well be a basic setup to put in.
Yeah.
And
to speak a little bit of that, I actually brought a issued individual first aid kit.
Sweet.
So
Let's take a look at that.
We can talk a little bit about what the military carry. Every soldier is required to carry one of these on their what we call our battle rattle. So our body armor. This is anybody that's got body armor on is required to carry one of these. This is called the Joint Individual First Aid Kit, or Joint First Aid Kit. So it's got a nice little.
So any service member that is wearing body armor
has
to have this
or is required to go. Say we're going on a convoy or we're going to do patrol. Anytime that these are almost always going to be mounted on body armor.
Okay.
They are usually mounted to a specific place so that everybody knows where. It doesn't have to go looking all over your body to find where your first aid kit's at.
Right.
So you'll notice on the outside, this is a very old Cat5 tourniquet that I have used way too many times, but it's great for training. We're gonna open that guy up.
Nice.
And you'll notice this has a nice umbilical cord, so if this is attached to that individual, I'm not gonna lose it when I go to pull it out and my adrenaline's going and I throw it halfway across the yard.
Wow.
Yep, it's a good time. Super simple. Obviously, this is there as a representative. You don't want to carry it around. This is called a nasal pharyngeal airway, and it goes up your nose and down the back of your throat to maintain an airway if somebody's unconscious. We don't want to do that if it's been sitting around outside the wrapper. So,
oh man, someone might get COVID.
Someone might get COVID. You never know. Or get tested for COVID inadvertently. You never know. So this is a compressed. This is just another emergency trauma bandage. Great little thing to have. And we're gonna slide that guy in there. A little compressed gauze, tape, a pair of gloves, another couple of things that might be in there. Where they have this mystical thing called the combat pill pack, which is essentially some antibiotics that I'm going to give someone if they are injured and I decide they need them as a medic. Tape. This is 2-inch wide medical tape. That's some tough stuff, and it'll handle whatever I need it to. Might throw in some combat gauze as well. This one has been it's been roughed up a few times, so there's a couple items that are missing, but we're going to have some combat gauze in there. We're going to have a tourniquet in there. You're going to have a compression bandage in there. Basically, what this is and what I tell my guys, this is the equipment that you are carrying for the medic to use on you if you're injured. This is not your stuff to play with. This is my gear.
Right.
But in order for me to not have a 900-pound pack so I can treat everyone, you're carrying this for you, or your combat lifesaver.
That makes a lot of sense.
Yep.
I'm kind of gathering I need to get some of this stuff and keep it.
Yeah, and it's not expensive. It's really another really good option is called Luco Tape. That's a little bit more spendy. It does not come off.
Okay.
It does not come off. I really like that. I carry some of it with me in most of my kits for hot spots, for blisters, and it can rub around in your boot all day and it doesn't move.
Wow.
I really like it. But this stuff works just fine.
Way cool.
Yep.
Way cool. All right.
So we can fold this guy back up. And then this is a little drop leg kit that I have developed personally for me to carry, where I don't necessarily want my medic pack on me, my what we call an M9, or the Blackhawk 2 stomp kit, which is a great big backpack that I can just load down if I'm doing a long range patrol or something. Something silly.
Okay.
This is just a drop leg, so we can go ahead and close that up. You can see it's got the buckle and attaches to your belt loop.
Oh, nice.
On the back, I actually have a seatbelt cutter.
Okay.
Made by Benchmade. I really like that one.
Oh, nice.
It's got enough grip on it where you can get a hold of it and really put some pressure on it if you need to, and it is scary sharp.
Wow.
If you open that up, I have a tourniquet that rides right in here. And I can just rip and go with that tourniquet, so I always have one easily available. I have a set of trauma shears. This is kind of an admin pouch for me, so I carry some documentation stuff for specific to the military.
Okay.
Duct tape, because it's awesome. A little more medical tape.
So you just roll up.
Awesome.
You roll up your own duct tape.
Yeah.
Nice
Tight little pack. That way you're not dealing with that 2-inch center roll. And it's a
Yeah.
little more compressed. That's like 120 feet of duct tape.
That's awesome.
Yeah, and that is more than enough to get you by fixing gear, or taping down bandages, what have you.
Right.
Yeah.
Nice.
Another trick that I do, so I do a lot of backcountry hunting as well. So I'll actually wrap 15 or 20 feet around either a Bic lighter or around my trekking poles.
Oh yeah.
And I'll have a roll of Luco tape that I do the same thing with. Saves a little
That's
space
super
that way.
smart. That's really cool.
I had the room here, so I threw in a cold pack for your rolled ankles, which is a lot of what I deal with, honestly. Or your people that are getting overheated, I can put that on the back of the neck or anywhere that I have arteries and help cool that body temperature quickly.
Okay.
Combat gauze. And then we get into our compressed gauzes. I have 2 or 3 packs of the compressed gauze, same stuff we were just talking about. A clean ace wrap. I can use this in conjunction with the SAM splint if I have one to secure that. I can use it to secure bleeds with the combat gauze, and there's certain ways you can wrap it and do all that kind of stuff. And that's like 99-cent store stuff. You're only going to use it once and it's going to get thrown away.
Right.
You don't need, it's not super expensive. Very, very worth it. It's more compressed gauze. Make sure I got everything out of the pouch. And then we get into our chest seals. I do carry a couple with me. This is called the Aisherman chest seal. It's just another, this is a Bolin. I apologize. Just another variety. This is obviously vented. Just another variety to carry with you.
Right.
And this, like I said, guys, obviously you can see that this is extremely expired stuff. This is a training kit.
Right.
Make sure your stuff is up to date, please. Now, if that's all you have, that's all you have. But you might end up, honestly, you might end up in some legal trouble with that.
Right.
And then, as we talked about earlier,
one.
a sealed one, also heavily expired.
Right.
Like I said, this is a training kit. This is just stuff we were going to throw away, so I stuffed it inside a pouch so I can train with it with my medics and stuff. So one thing you are going to need if you know how to use one of these is a little bit of lubrication. And I don't have any with me, so that's a fail on my part.
What would you use for that? Just like Vaseline kind of
honestly,
stuff?
Honestly, they make surgical lube.
Okay.
And it is almost identical. It's a water-based lubricant that is honestly identical to things you're going to find in certain shops we're not going to talk about. It's the same stuff. It comes in a little packet, and that is more than enough. If you're really desperate, blood works as a lubricant. If there's a lot of that laying around, you can use that too.
Okay. Oh, that's awesome.
So that's what that little kit is.
That's a good kit.
That's enough for me to treat, minus things like fluids or doing more advanced medical procedures. Like if you really want to get crazy with it, you can do needle chest decompressions. Those, I'll usually have a couple of these in there just because that is my role in my training as a medic. You can do, there's all sorts of more advanced stuff we can do. Obviously, I don't have fluids in here, all that kind of stuff.
Right.
This is enough for me to treat most injuries on one individual.
Okay.
Maybe two.
That makes sense.
Yeah.
That makes sense.
It's kind of the upgraded version of that guy.
Right.
Yeah.
Right. Okay. Oh, that's awesome. Thanks for showing that.
Absolutely.
Cool. Well,
do we want to talk about your truck kit?
Hey, let's go through my truck kit.
Let's talk about your truck kit real quick. Why not?
Why not? We got time.
We got time.
Nothing but time.
Yes, sir. Stuff all this stuff away so we don't have too much stuff just floating out and about. All right. Truck kit.
All right.
Boom. For starters, I really like this bag.
Yeah.
It's compartmentalized. So usually when I have a compartmentalized bag like that, I'll have one, like the top bag, that's my biggest priority. I'm going to leave a lap bleeding. I'm going to put all my stuff to stop bleeding in that bag.
That's okay. Good.
And then we're going to move on to breathing. I'm going to put all my stuff that'll help, like your chest seals and all some other advanced stuff that I'm not going to talk about here, for breathing. And put that in another pouch.
Nice.
And then airway control, like your nasopharyngeal airways, all your different types of airways that we're not going to talk about today because that's kind of some more advanced stuff.
Right.
I'll have that pouch full of that stuff. And then, or I might make one booze and Band-Aids. So little Neosporin, some what we call tailgate medicines. So somebody that cut themselves and needs a Band-Aid real quick, or has a minor injury that I'm just going to tape up and send them back. That might be one pouch, and then I might combine my airway and breathing into another.
Okay.
But
that's
I really like small compartmentalized bags like this. Reminds me a lot of what we call our CLS bags, which is a combat lifesaver bag. Has kind of the same stuff in it, but it rolls up into a nice compact thing like this.
Okay.
So to start with, we got a couple more SWAT tees. We already talked about these.
Right.
Not super familiar with them, but would be interested in learning.
Probably some YouTube videos on those.
Yeah, a couple of them, I'm sure. Sports tape. I always like to take my stuff out of the packaging just to save room.
Right.
That's one thing we don't want to take out of the packaging. It looks like we've got some non-compressed gauze there.
Keep that clean.
Probably about 6 or 7 yards.
Okay.
Yep. Keep that 6 or 7 feet, not yards, excuse me.
Okay.
Coban. This stuff is awesome for covering up injuries. If you've ever donated blood, if you've ever given plasma, had a blood draw, you've probably had this wrapped around your arm.
Yep.
Really good it latches onto itself. You can put a little bit of tension on it. If I'm going to use a lot of gauze on something and then an ace wrap, I might consider doing another layer of this stuff over the top of it just to kind of keep everything protected a little bit more.
Right. Another
SWAT tee. I like it. Like I said, those look like they would make amazing compression bandages. All right, emergency trauma bandages, type 1 and type 2. These are essentially this very similar products. I am more familiar with this one, so this is kind of the one I reach for every time. It's made by North American Rescue. I like the brand. I know they make really good stuff, so I'm sure this is a great product as well. I just haven't had time to play with it.
Right.
And then a couple extra tourniquets and trauma shears. Wonderful. Good set of trauma shears. These are the same ones I carry in my kit. They're nothing super fancy. They've got a little slot for an O2 wrench, but they're great. Just a great thing to have. It's a great little truck kit. I'm really a big fan of this bag. We also have a little bit of documentation and a quick reference, combat casualty reference card.
That's awesome.
Go. That is based on what we talked about earlier, which is TC3. So you have basic manage under fire, tactical field care, all the different wounds that you can have in that case. Man, this is a really nice.
That's really. I should actually read that.
This is very nice. This is what I teach for my combat lifesaver guys.
Oh really?
And essentially, it's the 9-line medevac request that's specific to the military. But yeah, that's all stuff that, and I like that you could use a dry erase marker on this, write down your notes and wipe back off.
Okay,
yeah.
All right.
That's a great little card to have. I need to find out where you got that so I can give some to my medics.
Okay, that's awesome. That's all. Is there a brand on it?
Let's take a look.
Might be a company that's producing this. No, this thing.
Oh yeah.
North American Rescue makes this.
Hey, there you go.
They make all the cool stuff.
They make a lot of really good stuff. We use it very heavily in the military.
Oh, nice.
Very heavily. I'm gonna throw your other emergency trauma down.
Yeah, you bet. That's great.
Let's take a look at what this bad boy looks like when it's all wrapped up too.
Oh yeah.
It's nice and compact. It can go under a seat
Yeah.
in your truck. If you have a team where you want to have a dedicated medic, that's also a great thing. Might consider throwing a couple of these guys, a couple of our triangular bandages in there just for funsies.
Let's see that. I got the thing open. Might as well. If I don't do it now, I'll forget.
Right?
So
that's how I am too.
All right. Yeah. Okay. So we'll throw in a
ADD
couple
is
of those.
a son of a gun.
Yeah. All right.
Great. And this guy all folds up.
That's
nice
so
and neat.
cool. It is cool. Okay. The more we're looking at it,
this is a great little pack.
My wife bought this for me, by the way.
Wonderful. Yeah. She did a great job.
Good wife.
And it's even Molly, so you could attach it to whatever you want to.
Look at that.
Look at that. One thing I haven't talked about real quick is gloves.
Oh.
So anytime.
Oh yeah, good point.
I just want to bring it up. For a lot of us, it seems like common knowledge, but anytime you're touching anybody, whether there's blood or bodily fluid involved or not, gloves. You don't know what the status of that person is as far as certain things that you can't get rid of or can get rid of.
Right.
You don't want to, if you have something that you're not aware of, you don't want to give it to them back and forth. Bloodborne pathogens can be deadly.
Right.
Always want to make sure we're wearing gloves. This little green kit, I have a nice little front pack, so the very first thing I do is undo that zipper, and I've got a whole pack of gloves. Make sure they get ones that fit.
You get like ones that are sealed in individual
yeah,
pair
you can do that.
packs,
You can
or
do that
you
as well.
You just stuff in a
so
bunch
these
of
are
bulk
not.
ones?
Yeah, I usually do the bulk ones because gloves are not really sterile. In a tactical environment, you're not worried about as much about sterility.
Right.
You want to protect your patient from you and you from your patient.
Right. You want a barrier between you and them.
Just that.
Yeah, okay.
Just that nice little barrier.
Okay. That makes sense. So it doesn't matter if they're like necessarily like in a clean pouch or something. Well, I don't know. Yeah. Cool.
Yeah, and what I'll usually do is you can roll them up so that each pair comes in a nice little roll. Throw those in your bag. Keep in mind you're not necessarily in a hospital setting if you're grabbing this stuff, so the thicker, a little more heavier duty where they're not going to just rip apart on you.
Right.
They also wear out quickly. So
yes.
A pair of gloves that you've had in there for 3 or 4 years, you might want to check and stretch them a little bit, make sure they don't just rip in half.
Right.
Yeah. Good time.
I feel like I've had that happen.
I have had that. I have literally had that happen at a traffic accident.
Okay. Oh wow.
Learned that lesson the hard way.
Oh man.
Yep.
Well, this is great. We've covered a lot of stuff. Like I think the moral of the story is you are super experienced. I really appreciate you.
Absolutely.
I think the moral of the story is get training.
Get training.
Get training. Get the gear, but then get the training, of course, to know how to use the gear.
And don't just take my word for it, guys. I'm not the be-all, end-all. I'm a dirty line medic at the end of the day. There are a lot of people that know a lot more about this stuff than I do. If I misspoke at any one point, I apologize. But don't just take my word on it. go do. There are a lot of other good videos. There's a lot of good research that you can do as to what you want to fine tune your kit to.
Very good. That's great. Well, hey guys, thanks again for watching. If you haven't subscribed already, be sure to hit the big red subscribe button, hit the little bell next to it to be notified of all of our latest and greatest videos. If you found this video helpful, hit the like button. Thanks for watching, and we'll see you next time. Thanks a lot, Phil.
Absolutely.
All
My
right.
pleasure.